Welcome back to another episode of Health Talk with Virginia. Into our topic today, we are going to understand what is heart diseases, the common types, the common symptoms, the risk behaviors, and things that can help us overcome those heart diseases. So we have 3 common types of heart disease. Number 1, coronary heart disease. Number 2, high blood pressure or hypertension. Number 3, cardiac arrest. I'm going to define and explain them. What does that mean? Coronary heart disease. It's a disease that damages the heart blood vessels. You all know the heart contains of blood vessels, and once the one blood vessel is being damaged, coronary disease is happening. Then it's happened to destroy a person or individual. So high blood pressure or hypertension is also common in so many people out here. You could even heard that the kids or those who are old, that they are suffering from hypertension. If you've ever been in the hospital for treatment or internship, you get to understand, or for work, you get to understand how high blood pressure has become common into our life nowadays compared to the old days. This is because of so many things that I'm going to talk them down here. The other one is cardiac arrest. This is sudden or unexpected loss of a heart. Unexpected loss of a heart functioning, breathing, and consciousness. I hope you understand. It means cardiac arrest. It leads to death. It's a silent disease. You just wake up, you heard the news that so has been died because of cardiac arrest, something that is not communicating, it does not show any signs, it is just there with you, working with you, dining with you, living with you, sleeping with you. So I urge you, my friend, to check up your heart. So we have some risk factors that can contribute to this cardiovascular diseases. Number 1 is unhealthy diet. Number 2 is physical inactivity. Number 3 is tobacco. And number 4, harmful use of alcohol. Okay, I'm going to describe this into some. Okay, I'm explaining the unhealthy diets. What does unhealthy diet mean? It means that the food that we are it's not that the food we are taking is bad, it depends on how we are taking the food. Nowadays we'll get people eating the food that they are taking. When calculate the protein, the carbohydrates, and the vegetables, the protein is too high compared to vegetables. According to the studies and researchers, they have contributed that half of your meal, make sure it's vegetable. If it's not vegetable, it's fruit. But currently we are not doing that. We just eat nyama choma, cocoa fry, and whatever. So that's highly contributed to these diseases. And we also have physical inactivity. That means just relaxed. We eat, we drive, we sleep. We are not working out our body. We just, when we want to go somewhere, let me talk to our coastal people. They used to tuk-tuk. So when we want to leave the house, we call the tuk-tuk, we go. When we're done with the business up there, we call the tuk-tuk, we go back home. There is no time that we are working or we are doing exercise or just running. No, we just inside the house. That's really lead to those diseases because the heart needs to be activated. Or what am I going to say? The heart needs to be worked out so that it cannot be in a position of resting. You be active, you move as you can, you walk as you can, jump, skip. Those are the things that I'm talking about. And tobacco, those who smoke cigarettes, the tobacco level can easily damage your heart. So if you are used to that, please try to reduce it or just quit it. It cannot kill you. And then we have harmful use of alcohol. Also, harmful use of alcohol. Some alcohol are very what? Makali. They can damage your heart. They are not good to your health at all. Make good use of alcohol, not just drink, because people drink, you'll die alone. And then, so those are the mostly things that we do contribute to these heart diseases. And we have common symptoms of heart attack. This is pain or discomfort at the center of your chest, also pain or discomfort in the arm and in the left shoulder, in the jaw or at the back. You feel you are not comfortable. And then in addition, you can also have nausea, vomiting, shortness of breath, and headache, lightheadedness. You can also feeling faintless. You can faint, especially fainting is a common thing of heart disease. You can have cold sweat, you can turn pale, you can lose consciousness, you can lack of good speech. Sometimes when your heart is in problem, speaking well, it's also a problem. And then loss of energy on your legs. Yeah, the failure of to stand properly on your legs suddenly. This is a common symptom of heart disease, which you need to take action on it. And to add on that, there are some few points that we need to take caution. We need to take action on that so that we stop these diseases, because they can be stoppable. Number one, exercise regularly. You can make a norm that every morning you run, and if you're very busy, very busy, choose to run once or twice or thrice per week. It's very healthy, it's very important. You can just walk or exercise no matter how small your room is, like this one, but you can exercise. The workout doesn't matter. You can do sit-ups, you can do cardiovascular. That really helps the heart to pump the blood very well. And then when you exercise, it also gives the vessel the ability to enable the blood to move smoothly into your streams. That's number one. Number two, let's have proper diet or healthy diet. That means we include vegetables and fruits into our diet mostly. And to talk on that diet, please let's avoid excessively salt into our diet. Let's just use a simple and a little bit of table salt, and avoid also adding table salts on your meals after they have been cooked. It also contributed to these heart diseases. And then you can also choose not to fry your food regularly, just once in a while. Mostly cook the food, let the food boil, let the food get heated very well, and all the ingredients that we are using, like cooking oil and the salts, get boiled very well. That's really help to reduce the risk of these diseases. And then number three, the use of tobacco. Please, if you're using tobacco and cigarettes, try not to use, or try to teach yourself to avoid using them. because they are harmful. And also, if you're using alcohol excessively, try to teach yourself to reduce one by one. I know anything is possible once you decide, and once you say you will change, you will change, because it comes from inside you. So, and then move as you can. If you can decide one day not to drive and walk to the workplace, it's very good, it's healthy, it supports and help your health. So I think, to me, I'm used to vegetables. I'm a vegetarian. I'm used to eat so much nowadays. Since I get to understand this heart diseases is a big problem, I get to use of vegetables and fruits most of the time. And also, I've counseled many people to include vegetables and fruits to their meal, and they have seen some changes. So you can also do this, and it can work for you. So, as the world celebrated this day, I think I can celebrate it with my fans and teaching them 1, 2, 3, and I hope you learn something, and you'll make good use of those things that I've told you. So see you on our next. Bye. Stay safe. Stay blessed. We love you. If you're new here, join the family please by hitting that subscription button